This is an overview of Jacobsen syndrome. An estimated 1 out of 100,000 babies are born with Jacobsen syndrome. Jacobsen syndrome occurs in both genders, but has a higher prevalence in females to males with a 2-to-1 ratio. As of 2004, more than 200 cases were reported in literature. Some background information. The syndrome was first described by Danish geneticist Peter Jacobsen in 1973. He discovered Jacobsen syndrome within a family with multiple members that inherited an unbalanced translocation from a parent. His findings included a 3-generation family who displayed dysmorphic features, congenital heart disease, and members had intellectual disabilities. What is Jacobsen syndrome? Chromosomes are small structures that are inherited and carry genetic information. Each chromosome consists of a short arm and a long arm. Jacobsen syndrome is a gene syndrome caused by the partial deletion in chromosome 11. The genetic information is missing. This is also known as 11q terminal deletion disorder. Let's look at the diagram on the right. The deletion can occur anywhere on the long arm, but most times it occurs at the end. The impact and severity of the syndrome is greatly dependent on the size of the deletion of the chromosome, which can result in the loss of 5 to 16 million genetic building blocks. Causes of Jacobsen syndrome. Between 5 and 10% of people with Jacobsen syndrome inherit the chromosome abnormality from a parent. This is known as either a balanced or unbalanced chromosomal translocation. One or both parents can carry chromosome rearrangements where no genetic material is gained or lost. This is called a balanced translocation. This does not cause any health problems but can become unbalanced as chromosomes are passed on to the next generation. Children who inherit an unbalanced translocation can have a chromosomal rearrangement with some missing genetic material and some extra genetic material. These chromosomal changes result in the health problems characteristic of Jacobsen syndrome. The most occurring cause of Jacobsen syndrome is the spontaneous deletion of chromosome 11. This occurs during the formation of the gametes, the egg and the sperm, in the early fetal developmental stages. The signs and symptoms of Jacobsen syndrome are known to vary depending on the size of genetic material lost from chromosome 11. This can impact cognitive development. Most individuals have developmental delays in the following areas. Learning. Many have mild to moderate intellectual disabilities, but for some, learning isn't impacted. Gross and fine motor. Impairments in both motor skills and lack of coordination, which leads to difficulties in sitting, standing, and walking, and delays in speech. Communication development can also be impacted. The majority of people with Jacobsen syndrome learn to speak and some become fluent, but others remain nonverbal. The ability to understand language, which is called receptive language, is typically higher than expressive language, which is how a person expresses their wants or needs and includes social communication. Hearing loss is also very common due to frequent ear infections. Jacobsen syndrome can also impede on behavioral and social development. ADHD, or now known as attention deficit disorder with hyperactivity, is very common. It is reported that individuals are easily distracted and have higher than usual levels of activity during the day. Many also have compulsive repetitive behaviors. Some may also have sleep disorders that include restless sleep, where a person is in and out of sleep throughout the night. Some may also be dependent on another person to help settle into sleep or stay asleep. Other health factors can contribute to behavioral and social development, such as frequent ear infections and intestinal issues, including constipation. According to reports published from Genetics and Medicine, studies indicate some individuals with Jacobsen syndrome display characteristics similar to individuals with autism. When parents were interviewed and rating scales were given, individuals showed marked impairments in social, communication, and adaptive skills. Many who received a secondary diagnosis of autism spectrum disorder also displayed aggression, which included behaviors such as tantrums. Studies related to chromosome 11 and autism are being currently evaluated. Most individuals with Jacobsen syndrome have a distinctive physical appearance. These can include low-set ears, pointed forehead, wide-set eyes, broad bridge to the nose, a smaller lower jaw, and approximately 1/3 of those diagnosed also display microcephaly, an abnormally small head. Most individuals with Jacobsen syndrome also have co-occurring health impairments. Heart disease, known as hypoplastic left heart syndrome, presents in half of children with Jacobsen syndrome. This is where the chambers and valves on the left side are severely underdeveloped. Many also have gastrointestinal difficulties. Pyloric stenosis causes an infant to forcibly vomit. This occurs as a result of a blockage between the stomach and intestines, which may require corrective surgery. Severe reflux, also known as GERD, is also common and can result in difficulty of infants feeding. Frequent pain from constipation can also occur. Individuals may also have kidney disease. Some may only have one kidney. Double ureters are also tubes that lead from the kidneys to the bladder, swelling of the kidney, or cysts that develop on the kidney. Many with Jacobsen syndrome are short for their age. This is due to a shortage of the growth hormone IG1, known as insulin growth factor 1. Individuals should be monitored by a pediatric endocrinologist. Many may also have a bleeding disorder known as Paris-Trousseau syndrome. It's a condition where a person has low blood platelet count and characterized by a tendency to hemorrhage. There are several impacts on and considerations for self-determination for individuals with Jacobsen syndrome. Many may require supports in all aspects, including education, social, emotional, communication, and functional skills. With many supports needed, this will impact the demonstration of a person's independence. Therefore, individuals may feel that he or she may have fewer opportunities to express preferences and make their own choices. Since most will have medical needs, this may limit choice making due to necessities needed to maintain health. Individuals may have difficulty accessing the community due to communication and social skills. Individuals may need supports to create opportunities for social inclusion and participation. A person's quality of life can also be impacted. Emotional well-being. Individuals with Jacobsen syndrome may demonstrate frustration due to difficulty with expressing needs. He or she can be compulsive with decreased and flexible thinking. Interpersonal relations. A person may need support with initiating, maintaining social interactions, and developing peer relationships. Personal development. Educators should continue to support both students and families with transition planning. Physical well-being. Social, emotional, and behavioral development can be impacted by the multiple medical needs. Self-determination. Individuals may require intense support for all aspects of educational day. Allow opportunities for students to have control in choice making. Social inclusion. Individuals will need guidance and support with modes of communication. Rights. Educators should continue to support both students and families with transition planning and connecting families to service providers and agencies. Next are possible educational adaptations to support the following areas. Education. All adaptations and modifications will vary dependent on the deletion of chromosome 11. Early intervention. Opportunities for inclusion. Be mindful of the teacher-student ratio, since students may require guidance through direct instruction. Community-based learning. Participate fully and meaningfully in the community. Allow for natural moments of teaching. Provide visual supports, manipulatives, verbal cues, modeling. Provide both direct instruction and explicit teaching. Instruction can include breaking up assignments into smaller parts, student and small group ratio, allowing for longer student response times. Social includes peer training, peer support, social skills instruction, and role-playing. Inclusive settings can provide students with peer modeling. These natural learning environments can teach students social cues, including initiating and maintaining interactions with others. Studies show that peer supports can increase social and academic gains. Identify ways to increase peer interactions. Self-determination includes choice making. Provide 2 or 3 learning activity options and allow students to make a choice based on their preferences. As students become more proficient with making choices, they can be given more options. Self-management, taking care of personal needs, personal safety, and personal health. Self-awareness. Activities can include being an active team member in his or her IEP. Problem solving allows students to learn from others and develop and gain confidence. Possible educational adaptations are as follows. Behavioral emotional. Students may require a structured environment with clear schedules, routines, and rules. Reinforce desired behaviors. Withholding any attention from undesired behaviors to increase preferred behaviors, also known as positive behavior support. Provide immediate feedback in order to allow for direct instruction if needed. Sensory tools to promote self-regulation and increase focus. And allowing time for breaks or a quiet workspace. Communication. Functional communication training. Teach different modalities of communication, including verbal and nonverbal, to express those needs to obtain desired function. This can include vocalization, sign language, use of communication boards, words and picture cards, low and high-tech augmentative communication devices. Social activities. Find ways for social inclusion and participation. Families with children with Jacobsen syndrome will need lifelong supports and resources. Families often report feeling overwhelmed. Know that there will be challenges and struggles. Oftentimes, there are a lack of resources for families impacted by Jacobsen syndrome. Families need support. Identify good support groups and resources as coping strategies. Frequent travel time to multiple appointments to specialists and therapies. It can be difficult to find doctors who specialize in Jacobsen syndrome. And lastly, in an article published by the Human Development Institute, parents reported that their children with Jacobsen syndrome taught their families about patience, love, perseverance, advocacy, kindness, and empathy. Here are a list of resources for families. The first 3 resources include organizations for education, advocacy, information, and support. Chromosome Disorder Outreach Incorporated is a nonprofit organization. 11Q Research and Resource Group, and lastly, 11Q Research and Resource Group, a social networking site that includes family experiences with Jacobsen syndrome. The final is a resource for healthcare, where families can locate doctors and providers who specialize in specific areas. American College of Medical Genetics. The following are references for information included in this report. Thank you for listening to my presentation.